Hello and welcome to Open Line. I'm Starlene Stringer. You know, summertime means fun in the sun, but it can also bring some health and safety concerns. We want to help you make this summer the best it can be. Our guests today are from the Parkland Health and Hospital System. We have Dr. Francesca Lee, and we also have, she's a physician specialist, by the way, in infectious diseases and other fields too. And she's also an assistant professor at UT Southwestern Medical Center. Also joining us today, Shelley Stevens Stidham is the director of the Injury Prevention of Greater Dallas. And Sharon Cox is a registered dietitian. I want to thank you all so much for being here. Well, we have a lot to talk about, ladies, so let's get right to it, and we'll start with you, Dr. Lee. Everyone's talking about it, Zika virus. What exactly is it?
So Zika virus is one of a family of viruses called arboviruses, and that means that it's arthropod-borne, meaning that it's spread by a mosquito vector, some sort of an insect vector. And so it is a virus that is transmitted via a mosquito bite and has only really recently been getting the kind of press that we've been seeing. It's been around for a while, but as it's gotten closer to the United States, then people pay attention to it more. The virus itself is often asymptomatic, so something like 80% of people who are going to be infected are not going to have symptoms, but when they do have symptoms, it can be nonspecific fever, rash, muscle pains, and then the biggest concern is, of course, the potential for transmission from a pregnant mother to her child, and that can cause a lot of developmental problems for the baby prior to birth, and that's the biggest issue that we're seeing.
So are pregnant moms the ones who are most at risk, or who is most at risk?
So anybody can get it. It doesn't. You're not at any more risk of acquisition. Basically, anybody who can get bitten by a mosquito could get infected, but the complications, I guess the greatest morbidity, the greatest concern is in the setting of a pregnant mother or a woman who is planning to become pregnant, who you can also, now we know that it can be transmitted sexually from male partners, and so that is something to consider because you don't want to pass it to the baby. There are rare cases where people have gotten a condition called Guillain-Barré disease, which is a neurologic deterioration secondary to this virus. A lot of other viruses can do that too. But the biggest concern from a public health standpoint is really the risk to the babies.
I see, and a lot of people are concerned about mosquitoes, in particular at this time of year when folks are going out and doing things like swimming outdoors. And so that brings me to you, Shelley. I want to bring you in the conversation and talking about pool safety. What do we need to know about that? How can we keep kids safe?
Well, the best way to keep kids safe is to make sure that if there's a swimming pool around or something like that, that the swimming pool has four-sided fencing. And that's that the fourth side is not the house, but it's actually the swimming pool actually has a fence around all four sides with self-closing and self-latching gates so that a child can't get in and out. It just adds an extra layer of protection. We hear often that don't ever leave your child alone or don't take your eyes off of them for a moment. You were talking about your children. I have a 28-year-old, and I remember there's just no way that a parent can keep an eye on a child 24/7. So you need extra layers, and so environmental modifications such as four-sided fencing is the best way to protect children from drowning.
Great advice. And yes, we were talking about our children before the show. Dr. Lee and I both said we have 3-year-olds, and I have some other age children too. So how important do you feel it is to have swimming lessons for your children, and when should they start?
Swimming, it's controversial as to when it should start. My pediatrician recommended that I start immediately at 6 months. We chose not to do that. The literature is divided on what is best and what isn't. So I think the literature does show that swimming lessons is protective against drowning, but you still need to make sure that when you're swimming in larger bodies of water, lakes, rivers, and things like that, that you should always be with an extra person. And so don't just rely on the swimming lessons, but they are important.
Okay. And Sharon, I want to come to you next because I think about food when we talk about going outside and eating. A lot of us plan picnics over the summer break or maybe just poolside. You may have some snacks out there. So how big of a concern is foodborne illness?
Very important, especially this time of year with the heat, the temperature. You do want to make sure you keep your cold foods cold, keep it at least 40 degrees or lower. If you are taking, going to a picnic or a pool, if you have water or drinks, maybe put them in a separate container and always fill it to the top. And then you will keep your food in a different container so that you're not opening, to go get a drink. We all want to have drinks probably more often than we eat. So you would, keep them separate so that the temperature wouldn't cause any foodborne illness.
What is it that makes food become unsafe?
Is sometimes we undercook our food, so you really need a food thermometer so that you can check the temperature of, say, your chicken, your poultry, make sure it is at least cooked to 165 degrees. And also you want to make sure you start out with your food being prepped in a clean way. You don't want to end up, with cross-contamination. So if you're preparing your meats, then you want to use a separate cutting board, and then, cook it to the right temperature and then keep it cold, for as long as you can, if you're out. And then don't overpack or don't take too much food that you may not be able to consume. Because if it is left out longer and it reaches a certain temperature, then it could be, very harmful to it.
Great advice. Do you know how many times I've overpacked going on a picnic? We have so much food left, so I will keep that in mind. I want to come back to you, Dr. Lee, and talk a bit more about the Zika virus. What kind of treatments are available?
Nothing right now. It's only supportive care. So there is neither a vaccine to prevent it nor any kind of curative medications.
Interesting. And so that makes my next question a little frightening, because a lot of people are traveling at this time of the year, some wanting to go, into South America and parts that people have said, oh, maybe you shouldn't go there, and there's been different warnings about. So a trip to Brazil or other countries with Zika cases out there, what should people consider?
This is a hard one to answer. I think the recommendation is basically that if you are pregnant or anticipating becoming pregnant, you should think really hard about traveling to areas where there is widespread Zika transmission. Sometimes it's unavoidable. You have family members that you need to go see. I mean, there's reasons people have to travel, but if it's an elective visit, if it's vacation, maybe pick a different vacation site this year. If you're pregnant or planning to become pregnant, or if you are the male partner of somebody who is pregnant or planning to become pregnant, because we also know, as I've said, that men can become infected and they could then transmit the virus. But if otherwise, if you're still going to go to an area where there is transmission of Zika, then you need to take the preventative measures that we would recommend to anyone going anywhere where anything is transmitted by a mosquito. And so that is using a mosquito repellent with DEET or a similar agent, and that actually is valid here in Texas as well, to do that when you're going outside. If possible, wear long sleeves, long pants during the hours that you're outside, which is kind of painful in the summer, as we were discussing, because we like to run and it's really hard. So I'm a fan of wearing DEET, but you might be a fan of wearing long sleeves. I think you just have to pick whatever works best for you.
Right.
And then trying to avoid the biting hours, which are dusk and dawn, are the worst times. Interestingly, though, the mosquito that transmits Zika actually bites during the day, not as much, but it is a day-biting mosquito. So the stuff that you've heard for other mosquitoes, this mosquito likes to hang out, and it can kind of get you at any time. So you just need to be aware. You don't need to panic, you just need to be aware. And then it doesn't answer your question specifically about travel, but around your house and things like that, trying to prevent mosquitoes from being there. So draining any standing water is important around where you're living or in your community. And by the same token, you could, if your hotel has planters outside or something, you might want to make sure that those saucers are empty, that there's no standing water.
Makes good sense. And I want you to tell me, elaborate a little bit more about this. You mentioned if you're planning to get pregnant, you may want to avoid making that trip to South America this summer. And so when you say planning to get, would that be someone who's planning to have a baby in the next year, the next 5 years, 10 years?
So right now it looks like about 8 weeks is the recommended waiting period. Okay. So, if you're thinking about you're hoping to start trying to get pregnant maybe in December, not such a big deal. But if you're really trying to aim for summertime as the time of conception, that would be something to consider.
Okay, thank you. Now, there are a lot of people who will be staying right here in town for little staycations or maybe just enjoying some time out. And so I'm going to come to you, Shelley, because I know a lot of people will be riding their bikes this summer, just doing a little tour around town. And so what do we need to keep in mind when it comes to bicycle safety?
Well, I think the one thing is always make sure that your child and you need to set a good example, have a safe and approved helmet by the Consumer Product Safety Commission. And Texas or Dallas actually has an ordinance that requires children under the age of 18 to wear a helmet when riding. And I think that that's something that we probably forget about, but I would encourage parents to make sure that their child has a helmet when they're riding. And then to set a good example. And then the other thing is kids under the age of 10 just do not have the cognitive skills to be able to negotiate traffic and things like that. I know we all think that our kid is more advanced, But so kids under the age of 10 should be riding on a sidewalk as opposed to in the streets. Different communities have different ordinances and different laws regarding bicycle riding on the sidewalk. So you just need to make sure and check and see what your city requires.
Great advice. And let's talk a bit more about the helmets, because if you go into these stores, whether you're going to the large big box stores or going into one of the kids stores or wherever you may pick out your helmet, there's like a million choices. So what should you consider and look for when you're picking out a helmet for yourself or your child?
Well, most of the helmets that are on at the box stores and things like that are going to be approved. They're going to have the Consumer Product Safety Commission approval. Some of them will be approved for all types of wheeled sports like inline skating and skateboarding and things like that, and some are just approved for bicycling. So you want to look and see what type of approval that you're looking for. And then if for your children, because they may not want, helmets may be a little bulky and they may not want to wear it, let them pick it out, because if they pick it out, they're more likely to take ownership of it and want to wear it. And again, just as a parent, set a good example and wear a helmet too. I run and jog along the Katy Trail, and I see a lot of times kids will have on helmets, but the parents won't. So just, we need to be safe as well.
Exactly, good advice. And Sharon, I want to come back to you and talk a bit more about cold food. So what specifically, or which type of foods are you talking about when you say cold foods that we should be concerned with, keeping them cold?
Okay, cooked food, it could be your meat, your chicken or fish, but mainly foods that may contain eggs or mayonnaise or dairy products. You would want to make sure they are kept cold.
And what's the best temperature you say for cold
40
foods?
degrees or below.
Oh wow, and so how do we check that?
Well, if it's a cooler and you pack it, like I said, to the top with ice, then that probably guarantees that your cooked food will remain, cold and safe.
And what about hot foods?
Hot foods should be kept above 140. You do want to stay out of that danger zone between 40 and the 140, because that's where bacteria really grows really rapid. So if you're keeping your hot food, keep it where it is, at least that up to 140 degrees. And again, the best way to do that with your meat would be use a food thermometer.
Get sick one good time and you'll be thinking about this advice you gave us, and you'll say, next time I will keep that food safe.
Yes, to purchase a food thermometer.
Trust me, been there, done that. You can get very sick. I want to come back to you, Dr. Lee, and talk about those mosquitoes again. This time, not about Zika, but something else that we hear about in the news all the time. That would be West Nile virus. What are the symptoms for that?
So West Nile virus is another arbovirus, and it is transmitted by a different kind of mosquito than which transmits Zika. This is another virus where something about like 70 to 80% of patients who are infected are asymptomatic. So most people don't even know. Those who do get sick, and it's about 20%, 1 in 5 people, it's a non-specific febrile illness. So fevers, muscle aches, feeling crummy, the summer flu kind of description. A very small percentage of people, so under 1%, will actually have neurologic complications. So the virus does have a predisposition for the cells of the nervous system, and so it can actually get up into your brain and it can cause meningitis or encephalitis and cause inflammation of that, and then that can have a lot of consequences secondary to it.
So if it's asymptomatic and it just kind of seems like it could just be the regular flu, how do you find out if you have it? You just ask your doctor to test you, or is that not necessary?
And most people aren't going to even come in for attention. I think they come in 2012, we had a lot of people who did seek evaluation for something they may otherwise not have, because everybody knew that West Nile outbreak was taking place. And so we did a lot more diagnosing than we probably ever would have. Certainly if you are not thinking straight, your headache is terrible, you can't see right, you have problems with your movement, you're falling, those kinds of things, people should definitely come in to get seen.
And so if you do have those symptoms, how's it treated if you do have West Nile?
Again, it's symptomatic. So the problem with all of these viruses is that we don't have much that we can do for it other than supportive care. And sometimes we may use things to try to reduce inflammation. We may use things to try to get rid of an immune response that might be overreacting, but those would be in individual settings. In 2012, UT did put together a protocol for patients to try to get them on a possible study drug that, again, there's very little data, so we were trying to get this together, but by the time everything had gotten done to get the study ready, the outbreak simmered down because fall hit. And so we didn't get a chance to really do it, but we have it, so should there be another outbreak, we could ramp it up.
So what would you say is the best way to prevent getting it? Is it the same tips you gave for Zika?
Yeah, it's all the same. I mean, mosquitoes are mosquitoes. The West Nile virus mosquitoes do tend to bite more at night and, you know, dusk and dawn, so they do follow the rules that you think mosquitoes should follow.
Okay, well that's good. At least they're kind of
Yeah,
staying where they should be,
Yeah.
you know, dusk and dawn. So I'm going to come back to you, Shelley, and talk about safety again, and this time moving from bicycles to boats, because a lot of people like doing boating. What should we keep in mind if you're hitting the water and going boating this summer?
Boating can be a very fun recreational sport. I think the thing that to keep in mind here is that alcohol and boating doesn't mix, just like alcohol and driving. A lot of people want to have a beer and out on the boat and things like that. And what alcohol does is it increases the likelihood that you're going to get dehydrated, which will then impair your balance, your decision-making skills, and things like that. So it's just, let's stay away from the alcohol when we're out on the boat and near the water and things like that. And the other thing is, if you're boating, make sure that you have an approved personal flotation device, or a PFD. And the things that we see in the stores, like the little floaties and things like that, are not approved flotation devices. And so that you shouldn't rely on those to protect you or your child. A lot of times it will give the child a false sense of security, but they're not approved flotation devices.
It's interesting that you say that. I was at a water park recently with my daughter and some of her friends, and I realized that they won't let the kids go in with the little floaties that go on the arms. And is that the reason why?
Probably. It's possible. I don't know. I don't know which water park and what their policies are, but it's possible. The floaties are just, they look cute. They'll keep their head above water if you're watching them and you're within arm's length. And that's the other thing. It's important when your kids are around water to keep them within arm's length to the extent possible. A lot of times people will also have like the little blow-up swimming pools in their yard and things like that. And we've actually seen some drownings as a result of, we've just kept the water in them, and the kids, particularly infants who are just starting to crawl and they really can't stand up and they can't balance well, will topple over into them and then they can't right themselves. So if you've got one of those blow-up pools in your yard, make sure that you drain it. I know it's a hassle. Again, you don't want it collecting mosquitoes and things like that anyway, which, by the way, I'm running out to buy some sun protective stuff right now. But it's you just need to drain those. Don't leave water lying around like that, because kids can drown. Particularly young infants and toddlers can drown in even like less than a 5-gallon bucket of water. So.
Wow. And because that standing water attracts mosquitoes,
Absolutely.
right, Dr. Lee?
Yep.
Exactly. And Dr. Lee, what about swimming in lakes and rivers? Is there any concern about infections when it comes to that? Because people are going to get off those boats and a lot of them go swimming.
Yeah, so there are a couple of different things honestly, in lakes and rivers, the probably scariest thing that you might have heard of at some point is the brain-eating amoeba that people talk about, Naegleria. It is a worldwide distribution organism. It's a parasite. It's in the soil. It's in the water. It's in warm water, actually. So hot springs, shallow waters, sort of the muddy area where the lake kind of hits type thing, not in salt water, so actually not in the ocean. And there's very little known about why certain people get it and others don't. The method, the mode of acquisition is basically inhalation through the nose. So the thought is that, dive in or splash or whatever, and then it gets up and then it goes up into the brain, essentially, is what is thought to happen. But we're talking about under 10 cases per year, so very hard to get good data on it. 99% mortality.
What would you say is the best protection?
Don't sniff the water.
There you go. Good advice.
Just be careful.
Just that simple.
Yeah,
be
but
careful.
again, it's so rare that we don't really have enough information to say. One thing to clarify, you don't get it from drinking the water, and that's important. So if you swallow water, that's not a method of getting it.
Okay. So swallow the water, just don't sniff it.
Yeah, there you go. Yeah.
Okay, so I want to come to you, Sharon, and talk about sniffing, and not the water in particular, but the smell of foods or the sight of foods that may have spoiled. Can you tell if it's spoiled by doing that, sniffing, smelling, or looking at the food?
No, you really can't. No. If you're not sure about it, then throw it out. If it's been out or if it's leftovers and it's been out for more than 2 hours, then just go ahead and get rid of it. Because, looking, smelling is not a guarantee that the food is still safe for you to eat.
Okay, thank you for that advice. And Dr. Lee, I'm coming back to you to talk about mosquitoes again.
Great.
But something different. I mean, Those mosquitoes are busy this summer.
Yeah.
This time now, I don't know if you say, because I've heard it pronounced chikungunya and chikungunya.
I say gunya.
You say gunya.
Yeah, I think
so
it's
we'll
cooler.
go with gunya. It does sound kind of cool, right? They're not cool at all, though, the
No.
mosquitoes that carry chikungunya. Tell us about that. What is it?
So the same mosquito that carries Zika can transmit chikungunya virus and can transmit dengue virus, actually, too. So it's a 3-for-1 mosquito. And really, they're all arboviruses, again, that arthropod-borne kind of infection. And they all sort of do the same thing. They give you fevers, they give you rash, they give you muscle aches, they make you feel crummy. You know, Zika seems to have, you get a conjunctivitis, red eyes. Dengue is called breakbone fever because people sometimes will get really, really bad bone pain with it. Chikungunya just really can just make you feel sick for a long time, basically, just like the flu that never, never, never goes away, but very rarely kills anybody, which is good. So very common, rarely kills. And actually, dengue and Zika and West Nile, we said a significant number of people actually don't even show symptoms. Chikungunya, actually, the majority of people actually will show symptoms, so it's sort of the flip for that. But
I love my doctor, but if I get any of these symptoms, I'm coming to you because you know the difference, and I'm not sure he does.
I mean, we're happy to see you, but the problem is we can't do much for any of these things other than try to get a diagnosis for you so that you can actually say, well, at least now I know why I feel terrible.
So are there any cases of chikungunya here locally?
Yeah, so Texas just had its first locally reported transmission. It went through the Houston Department of Health, but it wasn't Houston County, it was a different county. And the case actually, I believe, was from last December, but it only just got reported.
Okay.
So yes, we have it in our
It's
state.
here. Oh boy.
Nationally, though, the majority of these cases for all of these viruses, with the exception of West Nile, they're imported. They're folks who traveled and then came back infected.
Okay, well, thank you for that, I think. That's just, oh my goodness, so many things to think about when it comes to mosquitoes. Shelley, I want to switch just a minute because I know a lot of people will be taking road trips this year. They always do for summer breaks. And so that brings a concern for booster seats and car seats. What do parents need to know to keep their kids safe in those?
Well, you're right, and with gas prices cheaper, more people are likely to be traveling by car than in previous years. The important thing to remember is just all year round, not just in the summer. Be sure to keep your kid in an approved car seat. Texas has a law that requires they be in some type of a car seat or a booster seat until they're 8 years old. The best practice recommendation, though, is to keep a child that is 4 feet 9 inches or 80 pounds. They need to be in some type of a booster seat. Texas decided to go with an age. It's just easier for people to say, how old is your child, as opposed to get them out and weigh them and measure them and things like that. But the recommendation is that they be in a booster seat until they're at least 4 foot 9 or 80 pounds. And the same goes for adults. You need to be in a seat belt. Texas has one of the strongest seatbelt laws and child passenger safety laws in the country. And so we are required to be belted regardless of the seating position and regardless of age. So you keep your kids in a car seat or a booster seat until 8 years of age, and then everybody else needs to be in a seat belt, regardless of whether you're sitting in the front seat or the back seat.
Good advice. You want to keep everyone safe. Now, I know the city of Irving has a partnership. They program with an organization that helps people properly install their car seats, because sometimes they can be very tricky. If you're a mom, you know what I mean. A dad, you know what I mean. They're hard sometimes. So there is a program here in Irving that helps with that. But are there other opportunities too?
There are, and we've worked very closely with the city of Irving, the police department here. We've been working with the Injury Prevention Center has been implementing a project for the last 5 years with Texas Department of Transportation funding called Give Kids a Boost, and it's trying to encourage families to keep their kids in a booster seat. As part of that, there are also opportunities to take your child or your child's car seat to what is called a fitting station. So there are some in Irving, there are some in the Dallas area. Safe Kids Dallas also has several fitting stations. So if people are interested in finding out the location of fitting stations, they can call our office, and that telephone number is 214-590-4455. And we have information about the different fitting stations that are available and when in North Texas.
Thank you. We're almost out of time, but I want to come back to you for just a minute, Dr. Lee, and ask you one more time, when it comes to protecting yourself from mosquitoes, what's the most important thing to remember?
Don't get bitten.
I love her. Very good advice. Just avoid getting bit at all costs.
Keep them from growing in the first place. So I guess, as well as draining water, support your local health department, county efforts to control the mosquito population. You know, they're not spraying to be obnoxious. They're trying to do it to keep people safe. And then protect yourself and your family by the means that we talked about with DEET and clothing.
Wonderful. And Shelley, I want to ask you, what are some of the most common mistakes that you see parents make?
As parents are always going to make some mistake. I think probably the biggest thing is motor vehicle crashes are the leading cause of death for kids and for people under the age of 34. So I think the biggest mistake is just not putting their kids properly in this car seat or a seat belt. Even on short trips, people think, oh, I'm just running to the grocery store and nothing can happen. And most of the crashes actually occur within a 10 to 25 mile radius of home. So. Wow. Just be sure and buckle up and be safe.
Good advice. And Sharon, what are your best tips for keeping food safe outdoors?
Outdoors, again, have that cooler packed with ice. Take the right amount of food so that you don't end up trying to eat food that may already be harmful for you. And just make sure you do clean and prepare your food, to the proper temperature.
Okay, Shelley, I want to come back to you one more time because there are some people who are not familiar with the Injury Prevention Center of Greater Dallas. What exactly is it?
We are a department at Parkland Hospital. We're unlike other departments in that we do not do clinical things. What we are doing is working in the community to prevent injuries, and it's those types of injuries that car crashes, burn injuries, residential fire injuries. I like to say we do injury prevention across the lifespan and across all intents. So in addition to the unintentional things that I just mentioned, we're also looking to prevent child abuse, domestic violence, suicide, and things like that.
And so how can people use your services? They contact you?
Again, call us. We are working, as I said, in the community. Most of the things that we do are what we call evidence-based strategies, and those are the things that are making environmental changes or policy changes that make safety the default. We're all parents, we all make mistakes, and humans will make mistakes. But when the human fails, we don't want the system to fail, and so we're trying to do things that the seatbelt laws, the car seat laws, and things like that make safety the default.
Safety seems to be the key word of having a great summer. So thank you all for being here, taking time out of your schedule to tell us how we can all stay safe from mosquitoes and food and all kinds of things that we're planning to do, like boating and swimming. So thank you, ladies. We appreciate you and your time.
Thank you.
Thank you. And thank you for watching. I'm Starlene Stringer. Please be sure to join us on Thursday, July 14th at 1:30 p.m. for our next edition of Open Line. We'll see you then.